Welcome back to part 2. Now we're going to get a little bit more in depth. We're going to talk about the difference between medical sepsis and surgical asepsis. Medical sepsis are procedures to decrease the number of organisms and impede their transfer. Those are things, hand washing, barrier techniques, we're going to talk a little bit more about those, and just cleaning. While we're talking about cleaning, let's talk about some different types of cleaning. Decontamination. You're getting rid of the contaminants. Cleaning is just removing soil from objects. You can scrub it with soap and water or enzymes. If it's blood, there are some things you need to clean with enzymes. First thing you want to do is you want to rinse with cold water and then scrub them with warm. Now the reason for that, there's a rationale for just about everything in nursing. The reason for that is hot causes the proteins to just really sink in and grab on. It kind of denatures them right around it. So you want to rinse it with cold first so that that doesn't happen. Then you can scrub it off with warm, and then you want to rinse it with warm. You want to make sure that you clean any equipment that's dirty as well. You want to wear protective gear if you're dealing with any blood or body fluids. Other terms, disinfection, it removes most of the bacteria, fungi, protozoa, most of the microbial agents, except spores. They don't do anything with spores. Disinfectants would be like your Lysol, your bleach. They're going to do a great job of getting rid of the majority of the problem. Sterilization, that kills everything, including the spores. It's complete elimination or destruction of all microorganisms, including spores. Whenever you're taking care of a patient who has Clostridium difficile or any other bacteria that's carried by spore, you need to wash your hands. You cannot do the alcohol thing. That just moves it from one spot to the other. It does not do you any good as far as protection. When you do wash your hands, you want to wash them correctly. And you want to wash them before care, when they're soiled, and when your gloves are removed. Every time gloves come off, you wash your hands. You want to use clean gloves. They provide a barrier for you and for the patient, protects you from blood and body fluids, protects them from anything you've got. You want to use sterile gloves when you're performing sterile care, performing sterile procedures. Prevention of infection always begins with hand hygiene. You want to use gloves during direct care. You want to use strict aseptic technique when you're inserting IVs, urinary catheters, or when you're suctioning an airway. A lot of times we'll say that these are sterile procedures. Kind of a misnomer. The only place I really see sterile technique is in an operating room. That's where you have everybody's wearing the gloves, everybody's wearing the gowns, they're wearing the mask, they're wearing the hats. You've got somebody that's walking around the room just looking for somebody to mess up, and they will call them. Doesn't matter who it is, they will call them, and everything has to stop until you make it. You fix it. You got to change out gloves, change out gowns, whatever you messed up. You got to fix that before you move on. You never have that level of intensity to bedside, so it's more strict aseptic technique than it is sterile technique. You try to keep things as clean as you possibly can, but you understand you're not really in a sterile environment. You want to have patients cough and deep breathe. That's how they keep infection out of their lungs. You want to make sure that you turn them. You want to make sure that you perform meticulous skin care and offer optimal nutrition. You have 2 tiers of isolation precautions. The first tier is standard precautions. And everybody gets standard precautions. You are going to use those anytime you're dealing with any body fluids other than sweat. Any non-intact skin, any mucous membranes, you all need to do standard precautions. Again, that's when you do your hand hygiene before, after, and between patient contact. You're going to use your PPE if you suspect that you're going to have contact with body fluids. When I say between, I mean if you are going to do a dressing change and you're going to empty the Foley, you're going to change the gloves in between that. You're going to do the clean first, so you're going to change the wound first, then you're going to wash your hands, change your gloves, then you're going to empty out the Foley catheter. You use separate gloves and you clean in between. You always go clean to dirty. No artificial fingernails. Never recap needles. Always use the sharps container. and make sure that they do respiratory hygiene. They also call that pulmonary toilet, and that's your turn, cough, deep breathe. I know, it sounds gross, doesn't it? Your second tier of transmissions, these are more agent specific. You have airborne, and that's when your droplet nuclei are less than 5 microns. You're going to use this when if the patient has measles, chickenpox, varicella zoster, pulmonary tuberculosis. They're going to need a private room. They're going to need negative airflow, which means that it draws the air from the facility into the room, and then it's vented out. It doesn't go back into the general circulation because those microns are really small. And you're going to need an N95 mask, and that's what this is. See, this has a metal piece inside. This mask is very thick, okay? Very good, and you are all going to get one of those because the first day of class, first lab we've got, everyone's going to get their own, and it fits on the face like that. The other kind of mask that you're going to use for the next group is droplet contact, and these are droplets that are greater than 5 microns. They're not as fine. You don't need such a finely weaved mask. This one has more of an accordion style look to it. Some of them tie behind the back of the head, some of them flip around the ears, but they kind of fan out. They've also got a little metal piece that goes over your nose, but they're much thinner. They're almost like paper, but they're finely woven enough to keep out those greater than 5 microns droplets. The bacteria that your disease processes, these patients are going to have are diphtheria, rubella, streptococcus, pertussis, mumps, mycoplasma pneumonia, meningococcal pneumonia, and pneumonic plague. These patients, again, need to be in a private room, or they need to be cohorted. If you've got a massive outbreak and you've got a lot of people that have got the same problem, you can put 2 of the same problem in the same room. You just don't want to put someone that doesn't have that problem in that room because they will catch it. And they still need to wear a mask, or you do rather, whenever you go in. Anybody that's visiting needs to be wearing the mask. The next transmission-based precaution is contact. And if you're going to have contact with the patient or their environment, you need to be wearing the gloves, the gown. If you're going to be touching up against the bed or up against the patient, you're going to need to wear the gown. They need to be in a private room or a cohort. These ones are for VRE, which is vancomycin resistant enterococcus, MRSA, which is methicillin resistant, Staph aureus, Clostridium difficile, Shigella, herpes simplex, scabies, herpes zoster, and RSV. And RSV is respiratory syncytial virus. This is for babies. It's like less than 3-year-olds have this, have RSV. After they're 3, you just call it cold. But up till then, you have to get real specific with what's causing all this drainage because it is very virulent. And it causes the kids a great deal of distress. The other type of isolation is not so much the patient's got something that you're trying not to get. It's the other way around. You have a patient that is in a protected environment. They've had stem cell transplants, or their white blood cell count is very low. They've had radiation, they've had chemotherapy. They do not have a very good immune response. They need to be in a private room. They need to have a positive airflow, which means that the air is sucked from the room out into the rest of the hospital because you don't want to draw all the bacteria and all the viruses that are in the air in the hospital into that patient's room. You want it to go the other direction. So you want a positive airflow room. Now you want to wear the mask when you go in because every little germ that you've got can prove deadly to them. So now you're dressing up to protect them from you. And everybody that goes in needs to do that. And they need to enforce that and make sure that no one's bringing anything into them. Very, very important. And if the patient has to leave for a test or something, they need to wear a mask so that they're protected from what's out there in the hospital. Culture of safety is something that we create. Nurses create a culture of safety when they follow standard transmissions-based guidelines. The rate of hospital faculty and staff not washing their hands in most places is horrendous. You're going to see it a lot when you go to clinical. Does not excuse you from it. We hope that every generation of nurses improves upon the last one. And the one way that we need to improve is to really, really, really enforce and make sure that we follow these standard precautions, because so many infections can be prevented just by simply washing your hands and wearing gloves when you need to. So it's an expectation for you. Whether or not anybody else does it, you don't go with the flow. You do what's right. You do the gold standard. You create a culture of safety. You provide education to the patients, to the families, to the healthcare team about the hazards of not following precautions. Hold them accountable. Whenever I was working in a hospital, we had to remind the physicians, if they were going to go in and put in a central line, we had to watch them wash their hands. And if we didn't see them, we had to say, I'm sorry, I did not see you wash your hands, and I need to see you wash your hands. As a new grad, that is not a comfortable thing to do, but you need to do it. You need to make sure that everybody is following the rules. Be polite, be professional, but you need to be consistent in making sure that you provide the best possible care for your patients, and so does everybody else. Okay, another quick check. We're going to do a patient's admitted with a diagnosis of AIDS and tuberculosis. So what level of precaution should they be in? And what interventions should you implement? When you come into the lab, we're going to practice applying PPE. First thing you always need to do is introduce yourself. Poke your head in the room. Remember, they're not seeing people, they're seeing masks and gowns. So you poke your head in the room, make sure you're at least 3 feet away from them, and introduce yourself. Let them see you, what you look like without the mask and gown. Then get it on, and then go into the room for real. Be able to explain what you're doing, why you're doing it, why are you wearing this mask and gown. We're going to take a short break, and we'll be back and we'll talk about surgical sepsis.